Millions are calling it a miracle. Doctors are prescribing it at record rates. But does Ozempic truly control diabetes, or are we missing the full picture? Today, we expose both sides of the coin. This drug slashes blood sugar. It triggers weight loss. It even reduces heart attack risk. But it also silences your gut, shrinks your muscles, and may change your brain's hunger signals permanently. Ozempic, Semaglutide, a GLP-1 receptor agonist approved by the FDA in 2017. By 2023, it had become one of the most prescribed drugs on Earth. But what exactly does it do inside your body? Ozempic is Semaglutide, a synthetic analog of GLP-1, glucagon-like peptide 1, a natural incretin hormone your intestines produce after eating. Unlike natural G1 2 minutes, the story of Ozempic begins in 1987 when Dr. Joel Habener at Harvard discovered GLP-1. 3 decades of research led to Semaglutide, a molecule that mimics this gut hormone with unprecedented potency and duration. Ozempic doesn't work on just one organ. It's a multi-organ drug. It targets GLP-1 receptors in the face, brain, gut, liver, and heart, simultaneously modifying insulin release, appetite, gastric emptying, and glucose production. Type 2 diabetes affects 537 million people globally. Clinical SUSTAIN trials showed Ozempic reduces HbA1c, the 3-month blood sugar marker. When Ozempic binds to GLP-1 receptors on pancreatic beta cells, it triggers a CAMP cascade. Crucially, this only activates when blood glucose is elevated, reducing hypoglycemia risk. When Ozempic binds to GLP-1 receptors on pancreatic beta cells, it triggers a CAMP cascade. Crucially, this only activates when blood glucose is elevated, reducing hypoglycemia risk. Simultaneously, Ozempic suppresses glucagon from alpha cells, the hormone that tells your liver to dump glucose into the blood. This dual action, more insulin, less glucagon, creates a powerful... In the brain's hypothalamus, GLP-1 receptors control appetite. Ozempic crosses the blood-brain barrier and activates POMC satiety neurons while suppressing hunger neurons. Ozempic slows gastric emptying by 30 to 40%, meaning food leaves your stomach more slowly. This glucose spike after meals. Research from the Pioneer trials showed this effect is most pronounced in the early treatment phase. The SUSTAIN-6 cardiovascular outcomes trial, a landmark 3,297 patients cardiovascular ages for Chopers, uses first cardiovascular drug to earn cardioprotection labeling. Your gut microbiome, the 38 trillion bacteria in your intestines, directly produces and regulates GLP-1 through L cells lining your gut. This is where Ozempic's story gets complex. While proteobacteria, associated with gut inflammation, increase, short-chain fatty acid production, critical for colon health and insulin sensitivity, can decrease with prolonged use. Here lies a critical fallacy. By constantly stimulating GLP-1 receptors externally, the body may down radiological concern Dr. Matthias Tschöp of Helmholtz Munich has actively researched. The vagus nerve is why Ozempic causes both beneficial satiety and troublesome nausea. When the drug overstimulates vagal G1 receptors near the brainstem's area postrema, let us examine what Ozempic genuinely delivers and the evidence backing it. 5 major advantages are supported by large-scale randomized controlled trials, the gold standard of medical evidence. SUSTAIN trials across 8,000 patients prove semaglutide reduces HbA1c by up to 1.8%. The SCALE obesity trial showed average weight loss of 15% body weight. SUSTAIN-6 proved 26% reduction in cardiovascular death, heart attack, and stroke. The 2024 FLOW trial, the first to specifically study kidney outcomes. Unlike insulin or sulfonylureas, Ozempic's mechanism is glucose dependent. It only triggers insulin when blood sugar is actually elevated, which kills 18,000 effects on from diabetes medication errors. Emerging evidence shows Ozempic may preserve pancreatic beta cell mass, potentially slowing type 2 diabetes progression. A 2020 GAV% of NASH patients achieving histological resolution, an unintended but powerful hepatic benefit. Now the other side of the coin, the disadvantages that major clinical trials, regulatory agencies, and independent researchers have documented. These are not rare events, these are pattern-level concerns that every patient must understand. SURMOUNT and STEP trials revealed that 30 to 40% of weight lost on semaglutide is lean muscle mass, not just fat. This is sarcopenic obesity risk. Gastrointestinal side effects affect up to 44% of patients with nausea, 24% vomiting, 30% diarrhea. More seriously, FDA pharmacovigilance data shows a 1.9 odds ratio for acute pancreatitis versus comparators. The biggest fallacy, the most dangerous myth. Ozempic does not cure diabetes or obesity. The Step 1 extension trial showed patients regained 75% of lost weight within 1 year of stopping the drug. Diabetes markers return, causing retinal vascular stress. Additionally, the drug costs $900 per month without insurance, making it inaccessible to the majority of the world's 537 million diabetics. What happens to your body over 5 years of Ozempic use? Long-term data from the SELECT trial, 17,604 patients over 3.3 years, provides the clearest window yet. The cardiovascular and renal benefits accumulate. The brain on long-term Ozempic is a subject of active research. 2017 Lancet study showed GLP-1 receptor agonists may slow Parkinson's disease progression, offering neuroprotection and dopamine innovation. Long-term Ozempic use induces metabolic adaptation. The body lowers its resting metabolic rate by approximately 5% through adaptive thermogenesis. Bone density may decrease as rapid weight loss reduces mechanical metabolic risk. A 2023 JAMA internal medicine analysis confirmed GLP-1 receptors are present in human thyroid tissue, elevating the theoretical thyroid cancer concern beyond rodent models. Professor John Wilding of the University of Liverpool, lead investigator on the landmark scale and step trials, stated in the 2021 New England Journal of Medicine. Professor Matthias Tschöp, CEO of Helmholtz Munich and pioneer of GLP-1 multi-agonist research, published a 20-cell gut microbiome perspective warning that unresolved Achilles heel of GLP-1 pharmacotherapy. Ozempic is not a miracle, and it is not a villain. For high-risk cardiovascular diabetics, the evidence is overwhelming for benefit. But believing it cures diabetes or works without addressing diet and exercise. Subscribe to the Diabetes to Reversal channel for educational videos, press the bell icon, and share it with your friends.